Hi, I'm Dr. Kathleen Moe, and as you guys know, we have an open house coming up November 7th, and I wanted to talk to you about something that's exciting that we're going to highlight at the open house. So many of you know about Juvederm and Restylane and volumizing, but the additional thing that Frederick Dermatology Associates is doing to kind of give that non-surgical facelift is Sculptra. So Sculptra, otherwise known as poly-L-lactic acid, is a sugar that essentially goes in and it's a biostimulator that can help keep the framework of the face lifted so that you don't fall forward and age as quickly. So what I'm going to do is show you a patient that has been getting Sculptra for the last few years, and I'm going to show you her pre-picture, and her name's Lisa. And as you can see on the computer screen, this is Lisa's pre-picture before she's had anything done. And what I want to highlight to you is, as we age, we skeletonize. And so essentially with Lisa, you can tell she's a slender woman, and anybody who's over 35, as they age, they'll lose the fat from their face, but we also lose bone as women. So she's kind of lost their fat through here on the temples, through the cheek area, she's lost fat, and then also through her jawline, she's lost some fat and a little bit of bone. So now we're going to actually do some injections of Sculptra on Lisa today, and we'll be able to see how those are done. And then because Lisa's been getting injections for a few years, you can actually see the results in comparison to her pre-picture. Okay, so we're back with Lisa, and you can see with Lisa's face, as I said, she's been only getting Sculptra injections for the last few years. So I want to highlight to you what Sculptra has done in comparison to her pre-picture. So if you look at Lisa now, you can see her temples are more filled in, although they still need some volumization. And then also her cheeks have some more volume. And if you take a look at her jawline, she just had an IPL, so some of these little brown spots and sun damage is coming up. But she's more full through the jawline. Again, this is the structure and the framework to keep your face lifted. So let's look at this pre-shot. Again, you can compare her temples, which are more hollowed out. Her cheeks are not as full, and her jaw is not as full either. Okay, so what we're going to do is work on the mandible. For a woman, again, to kind of help with this mandibular sweep and give her some more volume to keep her lifted down here, I'm going to use a cannula. So I'm going to initially use the pilot needle, and we're going to go in and we're going to make a little poke here. And this is just going to guide what's called a cannula, and that cannula is blunt-ended, so it delivers the Sculptra safely and less traumatically than using a needle. Okay, so we're going to take the cannula, I'm going to put it up to her ear line, and then we're going to slowly put the Sculptra in. And again, what that's doing is, over the next couple months, it's going to stimulate collagen and a little bit of bone here to kind of hold the lower half of the face up. So now that I've kind of worked on the mandible, I'm going to go to her temples. Her right side is a little bit more depleted than the left, so I'm going to start on this side first. So the temple, again, you have a fat pad here, and as you age, this gets depleted, and then the eyebrows and kind of the upper half of the face drops. So when you fill this in, either with filler or Sculptra, and the Sculptra is longer lasting, you're going to have a lift, a natural lift out of the upper half of the face. So what I'm going to do is I'm going to wipe her down with, again, my cleaning solution before I do any injections, and this doesn't hurt. There's some lidocaine mixed in with the Sculptra. Make sure I feel so there's no vessels here. And we're going to go in, and this is placed right on the bone. And slowly inject. And come out. Again, you can see she has barely any bleeding. And so essentially what I'm going to do is I'm going to work around her face. We're going to do her temples. We'll do a little bit more on the cheeks, the mandible on this side. And then we're going to send her out, and there's a little bit of post-care with the Sculptra. Generally what you do is you've got to, for 5 days, you're going to massage that area 5 minutes a day, 5 times a day. And over the next 2 months, she'll generate her own collagen. Versus Restylane or Juvederm, those things naturally take effect right away, but since those are not polylactic acid, they're hyaluronic acid, they don't last as long. And a lot of times for this area, again, it doesn't last as long and it's not as natural looking. So if you want to find out more about Sculptra or some of our other things we're going to be highlighting at the open house, like dermaplaning and our new cellulite cream, please come visit. It's November 7th from 5 to 7 p.m. Look forward to seeing you.